Now we're going to talk about common injuries in golf. All right, so what are some unique aspects of golf? Well, it's a low-impact sport, right? That's why a bunch of retirees play it all the time. Now golf, it's a repetitive, rotational sport, right? You're doing the same thing, you're swinging over and over and over again. I think some of us wish that we could swing the same way every time, and maybe that would improve our golf game a little bit. But you need to have both power and flexibility across multiple joints. And another unique thing about golf is whenever, it's a non-collision, non-contact sport. So if we have seen someone that's had multiple concussions and we're talking about retiring from that high impact sport or that collision sport, golf is one that we can easily recommend because there's no contact, there's no collision. So here's a question for you. What golf injury has the highest morbidity among pediatrics? Well, it's actually golf cart injuries, all right? We're actually seeing more and more golf cart injuries. Most of the time, these injuries aren't actually happening on golf courses. It's more a golf cart that the family owns or their friend owns, and the kids go out and drive it around and tip it, and a more serious injury can occur after that. All right, what about specific golf-related injuries? Well, acute issues, you see a lot of contusions, lacerations, and fractures. Now, why does that happen? Well, the most common mechanism of injury for these is hit by the golf club or hit by the golf ball. Just let that sink in for a second there, why that may happen. Well, what about chronic issues? The biggest chronic issue is back issues. We don't really know that much about youth golf injuries. It's likely that the second and third thing are more upper extremity issues, all right? Well, let me give you an example about an injury, not that common, but when we do see it, it's most commonly seen in golfers and also seen in baseball players. What can happen is when golfers hit the ball fat, which means that they hit a lot more of the ground than the actual ball. They do this over and over and over again, or have an acute episode where they hit it really hard. They can get some pain that they'll usually describe on the palm of their hand. And sometimes they'll get a little bit of numbness and tingling in addition to that pain, okay? So if you see this, please refer it to a sports provider for further evaluation. And the question is why? What could it be? There's something called a hook of the hamate fracture. The hamate is one of the bones in the wrist, okay? And so what can happen is you can get an x-ray, and this would be the x-ray. And you may look at that and that says, I don't really see too much on that x-ray. That x-ray looks relatively normal. Well, if you're not familiar with this type of injury, you may say, nope, everything's fine. You just bruised your hand, it's going to get better. But unless you get a specific x-ray or more advanced imaging, including an MRI or a CT scan, you may miss this fracture. And this, you can see the advanced imaging there. You can see that fracture right there pointed out by the yellow arrow. And this often has to get fixed surgically, all right? The question is, why do they often get numbness or tingling there? There's a nerve called the ulnar nerve that runs right by that bone there, okay? That nerve's job is sensation for your fourth and fifth digit, okay? So if that bone gets injured, it's possible that that nerve that innervates that fourth and fifth digit may get injured as well. And so that's why they may only complain of numbness or tingling in those fingers. Well, we've heard about this injury recently. This is PGA professional and Dallas resident Bryson DeChambeau. He recently had this injury and is currently recovering from this injury. He isn't back yet to full golf because he had to have surgery for a hook of the hamate fracture. I think Tim Tebow also had this injury during his short baseball career. Well, let's ask an expert about this. This is Daniel Stokes, another one of our great physical therapists. He actually has a medical certification from the Titleist Performance Institute. So he's a medical professional or a medical expert on golf and golf injuries. So he says most of the injuries that occur are due to tightness or a lack of mobility in a joint. So that's something that can be addressed for injury prevention. Another couple of key areas include the hip and the thoracic spine. So those would be good areas to address as well for injury prevention. Making sure you have a golf-specific warm-up program can help prevent injuries. And then making sure you're working with people who know about golf, right? That will help both with your athletic development and with your golf performance, and it will help avoid injuries. So just a couple of things. For acute issues, this seems intuitive, but making sure you give people proper space, right? The number one issue was getting hit by the club and hit by the ball, right? Give people space when they're swinging. Don't be in front of someone. You know, the ball can go in many directions, but it never goes backwards, right? And then for chronic issues, injury prevention is key. So this is something that Daniel has helped put together, an injury prevention and warm-up program that's specific for golfers. And you can see some of the exercises given here. This handout too will be available to those people here in person and virtually, so you can have it for your reference. You can see this young lady here working on some good core and spine mobility and strengthening there.